Now, immune suppression can either be as a result of two parts. We are going to have physiologic immune suppression, or we have pathologic immune suppression. Basically, in physiologic immune suppression, we have age. Children and old adults are going to have that problem. We have pregnancy. Basically, it's also involved with physiologic immune suppression. Basically, and we have also viral infections. When somebody is infected with viruses, so it is more of inside a pathologic than a physiologic immune suppression. Now, under the pathologic immune suppression, you have smoking, attitudes like smoking. Second one, you have a chronic infections like viral infections, like tuberculosis. It can be a state of immune suppression. We are going to have HIV. It's a chronic infection, like that's going to result to immune suppression. The next thing, we have malignancies. Malignancies like lymphomas or other type of malignancy can also result to immune suppression. We have malnutrition. Malnutrition can also result to immune suppression. We have chronic diseases like the chronic heart failure. We are going to have chronic renal failure. We are going to have chronic liver failure, can also result to that. We are going to have a patient that has after malnutrition, you have steroids. Patient is always taking steroids use. It can also be associated with that. So all these are elements that you have to evaluate on the background, and you can investigate on each of them. If you have generally HIV, you have also the eighth one, you have diabetes mellitus. Generally in patients that are adults or so generally when you have, and also we have the ninth one, sickle cell. If you have a young child who is having an infectious state, in the background you have to look for sickle cell, you look for HIV. Basically, if you have a young child that is having an infectious state, in the background you have to look for sickle cell, you look for HIV. Basically, if you have an adult, in the background you use mostly HIV, and if you have an old adult, in the background you are going to mostly visualize for diabetes mellitus and HIV. Basically, so those are the classification that you have to use. A child, you evaluate for sickle cell and HIV. In young adult, you just evaluate for HIV, and then in all adults you evaluate for HIV and diabetes mellitus. So those are the elements that you have to evaluate in the background, generally in the hospital. Now the next element that you're going to see here is the management of an infectious state.